All right, welcome back, everybody. This is Dr. Gerard Cuomo. I'm here in my Boca Raton office, flanked by one of my best ever dental assistants, Tina, and my patient in the chair waiting patiently. We're round three here, okay? Kind of got to go 3 rounds with a good fight. So we're now using a Cavitron tip. I'm going to blow air on the top of the screw itself. And we're going to go in and look at this pilot hole that I created. All right, so we went through backing it out conventionally, and then it ran into a roadblock, and now a pilot hole and a Cavitron tip. So the key here is to stay in the middle. So the tip goes in the middle like that, with plenty of water. I got it on low. And as it vibrates, you're going to turn it. And hopefully you get a miracle here, right? A little mini miracle in life. And you know, folks, I was going to slot it, but to be honest with you, my dental assistant told me to use the Cavitron. Why not? And I told her to go get it, and she thought I might get the suction, and then she went and got it. And look at that. A little minor miracle. So it pays to listen to your assistant. You could see there was a definite fracture in the thread, so that's what was causing it. You see the fracture there? It was just not going to come because it was broken. That first thread prevented it from coming out. Now it's coming all out beautifully. We're going to rinse this. There's a fragment right there. I don't want to all of a sudden turn on a frag. Yep, out it comes. Good day. Have you out in 5 minutes, sir. All right. I'll just keep turning this around, but here it comes. Now there's another instrument that I love to use, and I made this one from just a simple um, lab burrs. So you got tapered shaft, long lab burr, and I made these little forks on the end of it. So we could continue this way, or we can go ahead and just use an instrument and it'll get it out in a hurry. I think we're going to just continue. Look at that. It looks rusted inside. It's all beat up. Oh boy, look at this. But that was that first thread. All right. It looks like part of the second thread is fractured too. Look at that. That whole layer in there. We got a limper. He's coming out though. He's limping. Beat up. All right. Yeah, look at that. 2 threads fractured. Not one, but 2. We wouldn't be able to see that on an x-ray, nor could we see it from the top thread. It wasn't until the top thread fractured away. And now he's got 2 threads fractured inside. Definitely not something you can just try without a scope. You would have never known that. All right, I'm going to use an instrument now. I'll go off screen here, off mouth. He can close and rest. We're probably about 3 minutes from finish. This is a instrument that I created several. They are stainless steel, so they're going to rust a little bit when you autoclave them. But if you make enough of them, you can actually have one that you're comfortable in using. I'll just show you this. So a normal long shaft burr for lab, and then the end you make it look like the crown. You know, these are all razor sharp, and the idea is just to go in, engage, and turn, and get some movement. I'm going to put this one down. I see one's a little shorter than the others. We'll get one that's more uniform. Here we go. different diameters. This is a nice one right here. Let's use this one. Now you want to make sure that these sharp points don't gouge into the thread, so you're just lightly controlling the apparatus. I'll walk you through it. Okay, so we're reducing the magnification. We want to get the proper alignment. You're going to come over the screw head, or no head, but the screw fragment, and you're going to engage, and you're going to turn. And it's got to be engaged. I got to use magnification. I'll just it's a large crown and bridge mirror. There we go. So this is too small. We want a larger one. It's got a larger diameter. So my selection now goes to a much more, a wider one. If I don't have a wider, yeah, I do have a wider one. Let's come on back. And utilize a wider instrument. There we go. Perfect. Okay. Nope, these are exceptionally wide, so we're going to go back to the other technique. I'm just using the Explorer. We'll back it out. Maybe a little more cavitroning here, just to loosen it up. So the key is the pilot hole again. And actually I can just use this. And there it is. Alright, she's going to flip her. You got it. It's on the screen.